I'm here, registered physiotherapist. Today I'd like to talk to you about the referral pattern for the suboccipital muscle, which is the muscle right at the base of the skull, and how tightness or trigger points in that area can potentially lead to tension headaches. But before I begin, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So essentially the suboccipital muscle, it's a muscle that runs right along the base of the skull. And this muscle in a lot of individuals can be very, very tight. And when this muscle is tight, it will prevent us from doing small little chin nod movements. And so that flexion that takes place right at the top of the skull will be limited. And in some cases, you'll find that these individuals who are really stuck in that position will potentially experience almost like headache-like symptoms, and the reason for that is there's a specific referral pattern in those muscles where when those muscles are really, really tight, they will refer pain across the front of the head. And it has to do a lot with how it connects onto connective tissue that runs from the base of the skull to the muscles in the front of the forehead. And so again, when those are really tight, some individuals will experience tension-like headaches. And you'll see this a lot with individuals who sit for long periods of time, who are essentially in that forward head posture. So when we're like this, again, those muscles are in a tensed position versus when we're in more of a neutral position, it lengthens the suboccipitals. And so again, if we determine, hey, the source of this pain is coming from that area, there's a couple of great techniques that you can do to help release it. One is you simply place your thumbs in, there's sort of a little depression on either side, right at the base of the skull, and you simply put some gentle pressure there. And what you should find, especially if there are headache symptoms, is that it actually starts to diminish. And so again, there's a nice little exercise that can be done in terms of trying to get some relief. The other option too is you can use some tennis ball. So essentially I've got here in a sock, and then you can place that either up against the wall, so just like this, and then just lean into that slightly, or you can also do that same exercise just on your back. And then from there, I typically will get a patient to do some deep neck flexor exercises, which is essentially just thinking about bringing the chin to that middle portion of the neck. And again, what that does is it just helps to re-emphasize that flexion type position that in a lot of cases is quite limited when that muscle is tight. Please check with a physiotherapist to make sure that this exercise is appropriate for you. And thanks again for watching, and have a great day. Take care.